Welcome to our medical journey, understanding filariasis. Filariasis, also known as lymphatic filariasis, is a parasitic disease caused by an infection with roundworms of the filariasis type. These parasites are spread to humans through the bite of an infected mosquito and can cause significant morbidity. The disease is commonly known as elephantiasis due to the severe swelling it can cause. History of filariasis. The disease has been recognized since ancient times, with descriptions that match filariasis symptoms found in ancient Greek and Roman writings. The parasitic nature of the disease was discovered in the 19th century, but effective treatments and preventive measures have only been developed in the last century. Discovery of the filariasis parasite. The causative agent of lymphatic filariasis was first identified by Sir Patrick Manson in the late 19th century. Manson observed the life cycle of the parasite in mosquitoes, laying the groundwork for understanding the transmission of the disease. Symptoms and diagnosis. Symptoms of filariasis include lymphedema, swelling of the limbs, elephantiasis, thickening of the skin and underlying tissues, and hydrocele, scrotal swelling, in men. Diagnosis is typically made through clinical observation, blood tests to detect microfilariae, especially during the night when they are most prevalent, and imaging studies to observe the adult worms. Investigations for filariasis. Diagnostic tests for filariasis include blood smears taken at night, antigen tests for detecting filarial antigens, and ultrasound imaging to visualize live adult worms. Molecular tests such as PCR are used for accurate identification of the parasite species. Global impact of filariasis. Filariasis is endemic in tropical and subtropical regions of Asia, Africa, the Western Pacific, and parts of the Caribbean and South America. Over 120 million people are currently infected, with about 1.4 billion people at risk of infection. Prevention and control measures. Preventive measures include mosquito control, using insecticide-treated nets, and administering mass drug administration, MDA, to at-risk populations to eliminate the parasite. The WHO aims to eliminate filariasis as a public health problem by 2030. Treatment and conservative management. Treatment of filariasis involves the use of antiparasitic drugs such as diethylcarbamazine, DEC, ivermectin, and albendazole. These drugs help kill the larvae and prevent further transmission. Conservative management includes meticulous skin care to prevent secondary infections, physical therapy, and lymphatic drainage techniques such as massage to reduce swelling. Surgical interventions may be necessary for cases with severe lymphedema or hydrocele. Fun facts about filariasis. 1. Filariasis is also known as elephantiasis due to the severe swelling that can resemble the limbs of an elephant. 2. The disease is predominantly nocturnal, many of the microfilariae are only present in the bloodstream at night. 3. The mosquito acts as a flying syringe, spreading the disease from person to person. 4. The World Health Organization has targeted filariasis for elimination as a public health problem by 2030. Recent advances in filariasis research. Recent research in filariasis includes the development of vaccines to prevent infection and the use of new drug combinations to improve treatment efficacy and reduce the risk of drug resistance. Thank you for joining us. Thank you for joining us on this medical journey into the world of filariasis. We appreciate your interest and hope the information provided has been helpful.